Describe for me a stellar patient experience at a practice.
So, a number of characteristics. I would say from the first encounter, and I would say the first encounter is what I see on the internet.
Okay.
So, how educational is the content on their website? I would check their social media.
Amen.
I would look at their reviews. All of those things would mirror each other to send a consistent message that what they're saying, what patients say about them. So it's informative, it's heartfelt, it's credible. But I would look at all three of those: website, social media, reviews, what patients are saying. So that speaks volumes. Number two is when I call the office, is the person that I'm talking to courteous,
Yeah.
knowledgeable, and patient focused? Or are they transaction focused and they just, schedule an appointment, get you in, and they're just doing a function? So this is a high touch procedure. This is a major investment. It is life changing, and the entire experience should reflect that. So am I talking to somebody who, for lack of a better description, is wrapping their arms around me and from hello is taking very, very good care of me to understand what I want, to make sure it's convenient, that things are well described, things are well explained, and that I have the comfort to move forward. So all of those before I even step foot in the practice. From the moment I arrive, that I'm expected, that when I walk in, it's not, may I help you? But it is, Mr. Griffin, it's so nice to see you, and we're glad you're here. We've been expecting you, right? This isn't a factory. This isn't an implant factory that they're expecting you, and they take great care of you. The next is that someone on the team, whether it's the dentist, the treatment coordinator, but somebody on the team sits down with you first before anybody ever does an exam and sits down with you to truly understand what you want, what you're looking for, what your experience has been, and what the real outcome is that you want. So it is a person-focused conversation, not a tooth-focused conversation. The teeth will come later, but what do you as the patient, what are you really looking for? What's been your past experience? And what is it that you're really looking to accomplish?
How often should that be the dentist? And I don't mean to interrupt you, but how often should that conversation be the clinician versus an office manager, business manager?
The dentist needs to be included in that at some point. Every practice is different, right? So I would say this is a team effort. So the most important thing is that someone on that team sits down with you and truly understands what you're looking for, and then everybody on the team is plugged into that. Next is that you have a sit-down communication with the clinician, the doctor, the dentist, who is actually going to do the work, and sit down so that they truly understand you and they're plugged into all of those things that we've talked about. They understand the outcomes and what you're truly seeking for. Next, when we get to the clinical part, that the exam is clear, that you're involved in that. It's an interactive process. It's not, you're cut off and they're just working on you. They shouldn't be working on you at this point. They should be working with you.
Great point.
So good communication to say, Matt, here's what we're going to do first. We're going to take some pictures of your mouth, and what that's going to allow us to do is look beyond what the eye can see, and we're going to look at bone structure. We're going to look at how much we have to work with. We're going to take a look at all your existing things. In other words, they explain to you what they're doing and why and what they're seeing. They include you in the process, right? So that you're a partner in the process. You're not just a subject of what they're doing. Then, once that explanation is clear and you've gone through the code discovery process, now it's time to talk about what can we do for your particular situation and your condition, for what you want to accomplish. What can we do? What are the options to give you the best outcome that you said you wanted? Here are the options. Here's what we can do. Here's the plan that we would recommend. A good clinician will make a solid recommendation. They won't give you a bunch of choices. They won't say, Matt, you could do this, or you could do that, or you could do this, and confuse you with a lot of different options. If they truly understand you, then they should be able to say, Matt, for what you said you wanted and what we know how to do to get that outcome, this is the treatment we would recommend. Now, there might be other options that we could discuss, but here is the optimal choice for you and what we would recommend. I want a clinician that has the courage of their convictions in what they recommend. If they're not confident in their recommendation, I want a different clinician. I want somebody who can back up what they recommend with the courage to make the recommendation and to stand behind it. So now that I have that, once I've got the recommendation and I have the confidence in the team and the clinician that they can deliver, now it's up to, we have to talk about the details. So that's process, that's scheduling, that's financial arrangements. So that should be with somebody who can clearly lay out what my investment is, what my payment options are, what the timing is that's involved, all of those details. They make it easy for me to do all of the other things to get what I want. Then after that, it's clear communication every step along the way. Clearly scheduled appointments, when things are going to happen, what I need to do every step along the way, so that I have a clear path and I understand what my part is. Then we go through the process, and then on the other side, it's follow-up, that they take care of me and have a clear path of what happens after the procedure. Because whatever you have done, it's got to be taken care of. So whatever that looks like, my responsibility and what I need to do to get the best return on my investment, that's clearly mapped out for me. So that's a lot. I mean, for the ideal patient experience, that's what I would say would be a 10 experience.